Hi, good morning. I'm here performing nasopharyngeal suctioning. So I already checked the patient's chart, washed my hands, and right now I'm gonna wear clean gloves. So after wearing the clean gloves, I'm gonna prepare all the necessary equipments, such as setting the regulator up. So when setting the regulator up, we have to turn on the regulator, and then set the ideal pressure to about within negative 120 to negative 150 for adults. And then after that, we have to ensure if the connections are secured properly and is tightened. And here we have the connecting tube. Make sure there are no kinks also or any obstructions into it to prevent any problems. So I'm gonna place it in here. So after that, we have to prepare this stuff by setting the sterile gloves. Make sure it's fully opened, and then we have here the lubricating jelly. You can either put it in here in the clean container or a sterile gauze. And then we also have here the sterile water, so we're gonna pour a moderate amount of sterile water for the suction catheter. Then after that, prior to doing that, we also have to assess the patient by doing a patient assessment, checking the vital signs and everything. And then after that, we're gonna hyperoxygenate the patient. So assuming here it's a non-rebreather mask, so we're gonna put it on the patient. So make sure when putting this one is inflated. So we just assume it everything is going well. And then we have to hyperoxygenate first the patient, and then after that we also have to ensure if this one is working properly. We'll keep obstructing this one until we notice that manometer reaches more than to 150 or more. So I think it's all ready for patient's use. So after that, I'm gonna re-sanitize my hands, and then here I'm gonna wear the sterile gloves. And also, by the way, when prior to wearing sterile gloves, we can also either wear appropriate PPE such as face shield, goggles, mask, and even a lab gown. Especially if we notice the patient has many multiple secretions or the presence of blood, to protect ourselves. And then after that, we have to insert that, and then we prior to lubricating this, we have to instill it to the sterile water to make sure that it's functioning, it's able to suck water. And then after that, we have to lubricate it in a lubricating jelly. Make sure it's totally lubricated in order to insert it with ease. So after that, we have to remove the non-rebreather mask. And then we also have to inspect the nostrils if there are any problems, such as if we notice there is a deviated septum. So right now I don't use a nasal trumpet if the nasal trumpet is not in place, is not available. So I'm gonna insert this to the patient's nose. You have to insert it gently, and then when you feel first resistance, so you have to let the patient either cough or inhale. And then we also have to check inside. You should not insert it in a circular motion, because you might prevent any complications, such as it might cause bleeding. And then if it reaches to the point where you want it to be, you have to suck it. And then we notice there are secretions going inside. Then after that, we have to remove, and then you let the patient hyperoxygenate again. And then if you want to do another attempt, so we can either go inside again, and then when doing suctioning, you should do it in less than 15 seconds, not more than 15 seconds. And then another thing to note is, when doing suctioning, if you want to do multiple attempts, ideally you can do it 2 to 3 times only, not more than 3 times. So assuming I already did finish the suctioning part, so when I remove this one, you have to remove it, Then carefully remove this one, that, to maintain sterility, and then remove it together with the gloves.